This presentation is just going to outline what Stomp is, how the Stomp clinics are run, and what we're doing at NELFT to help support the Stomp clinics. So as Harpreet mentioned previously, what is Stomp? Stomp stands for Stopping Over the Medication of People with a Learning Disability, Autism or both. And the project was supported by NHS England and aimed to reduce the inappropriate prescribing of psychotropic medication that was historically used to manage behaviour that is deemed to be challenging and very often seen in the absence of a documented mental health diagnosis. When I say psychotropic medication, that means antipsychotics, benzodiazepines, mood stabilizers, and sometimes antidepressants. Next slide, please. So the main aims of Stomp are to raise awareness. So like I mentioned in the quiz, is to give parents, carers, families, and anyone who works with patients with learning disabilities options of the different resources that come with Stomp and options for other medication. It explains why medication is used in relation to challenging behaviour. It also introduces alternatives to medication, such as positive behavioural support, psychological therapies, etc. And obviously the main objective and the aim of Stomp is to improve the quality of life of our patients. Next slide, please. So there's lots of things to consider when we start off the Stomp clinics and when we're reviewing patients for the first time. So with regards to mental illness, there is a higher prevalence to the general population when it comes to a mental health diagnosis. So our patients who have learning disabilities are more commonly affected with mental health diagnosis, but that doesn't mean that they all do have a mental health diagnosis, and that's where Stomp comes about. So it is sometimes difficult to diagnose someone because of their presentation and their behaviour. So the most basic way, and the way I like to explain to students when I have them with me, is to say, if I want a glass of water, I could easily say to you, can you please pass me that glass of water? For a patient who finds it difficult to communicate, for a patient who is non-verbal, who wants a glass of water, how would they say that they want a glass of water? If they're around people who are not understanding them, they might become frustrated. And because of that, they might show signs of anxiety or aggression. And then when they're faced with someone who isn't an expert within the field of learning disabilities, they might miscommunicate that as, are they responding to voices? Are they responding to stimuli? And that's where the psychotropic medication starts. And that's where it's continued for a long period of time and not reviewed. So it's important to kind of understand the different challenges that come with our patients and to identify that trigger from the start rather than prescribing medication at the very beginning. We're all aware that learning disability patients have a lot of comorbidities, so they are prescribed a lot more medication than the general population, and that's where the polypharmacy comes into it. Epileptic drugs in particular, because they're more at risk of having epilepsy. Drugs, they have a reduced life expectancy, and they're also in a clinical risk group. And then, as I said before, the challenging behaviour. In the past, historically, there has been a reliance of psychotropic medication for our patients, whether it's regular or PRN when required. There is that reliance there. Next slide, Harpreet. And I'm sure all of you are aware of the side effects that come with psychotropics. So I won't go through this in a huge amount of detail, but you know, the pseudo-Parkinsonism, the acute dystonia, the restlessness, and the tardive dyskinesia that comes with that. Most of our patients will obviously go through that when they're taking this kind of medication. Next slide. And then the other common side effects that come with it: dry mouth, blurred vision, constipation is a very big one, weight gain, sedation, decreased sex drive, metabolic syndrome, and postural hypotension. Next slide. So how did Stomp first come about? Why are we doing this, and why was this project formed? So for those of you who don't know, it came from the Winterbourne report that was published in 2012. So this was from a team of investigators that went into a residential learning disability home. What these reporters found was that they were coming across patients who were heavily sedated, and because they were heavily sedated, they were being physically and psychologically abused from the staff within this particular home. So a huge pledge kind of came from that to say, right, we need to look after our learning disability patients within the community a lot more. Should they be on the medication that they're on? Why are they so heavily sedated? Why are they being in a position where they're being able to be abused by the staff that are working there? So we want to improve the quality of life of children, young people, and adults with learning disability, autism, or both who are prescribed psychotropic drugs. We want to make sure that people only receive these drugs for the right reasons and for the right amount of time. We want to improve the understanding of these drugs. So it's all about giving staff who look after these patients, the rest of the MDT, information about these drugs when they are prescribed and when they shouldn't be prescribed. So when is it appropriate and when is it inappropriate? We want to improve the understanding of non-drug treatments and the support which may help and make sure that people work with their doctor, with the rest of the multidisciplinary team, and the people who support them in making any changes to their treatment. So it's just making it clear that, you know, there's other options to medication. Medication isn't always the correct answer, and we would always try these options first before we resort to medication. And we want to empower people with learning disabilities, autism, or both, and their families with the right information to support them so that they can make more informed choices about their care. Next slide, please. NICE has produced some guidance around this, so I can send the link through to the actual NICE guidance if people would like to have a read of that, or you can just Google it. But they've produced a very good document on how we can, how non-pharmacological approaches are more suitable for patients who display challenging behaviour and who have learning disabilities, such as positive behavioural support, and it will help us understand the behaviour before even medication is considered. So this positive behavioural support is a plan that behavioural specialists within the team will help the people who look after the patient to work with. So they will go in, they will do an assessment on the patient, they will look at what their triggers for challenging behaviour are. So this could be, like I explained, the need for food or something and not being able to communicate that. It could be another resident entering the room that sets another person off. They might become anxious or aggressive in response to that. So the PBS plan will highlight these triggers and will give a clear instruction of what the staff need to do to manage that trigger rather than managing the behavior. So if we're managing the trigger, then the behavior won't emerge in the first place. So it could be taking them away, engaging them in activities, giving them food and drink if they need it, asking them if they're too hot or too cold, and just responding to that trigger there will stop that behavior from emerging. So it focuses, like I said, it focuses on making changes within the environment to better meet the needs. And the overall aim is obviously to help people with a learning disability live their best life. Next slide, Harpreet. So what is the Stomp Clinic team? So it is, like I said in the quiz, it is made up of everyone. I like everyone to be involved with the decisions that are made within the Stomp Clinic. So this will be behavioural specialists, the community learning disability nurses, psychological services, speech and language therapists, psychiatry, which would be the consultants and the doctors, physiotherapists, occupational therapists, and last but not least, myself as the pharmacist leading on the project. So initial consultations are done by myself and the consultant, but once a reduction has been agreed and we identify that a certain medication is deemed as inappropriate, we would make that decision to reduce. We would make sure everyone involved within the patient's care is in agreement and on board, and then we would then formulate a plan and the patient would reduce at various different intervals, just depending on how they are and what the case is. I would then do the follow-up appointment myself. So after a month or 3 months, just depending on each individual basis, I would just check in, do another clinic and make sure everything is okay. If they're okay and if they're doing well, we would then reduce further. If there are issues, we would ask other people from the team to intervene. So if the staff are not working with the PBS plan correctly or it needs updating, I would ask the behavioural specialist to take another look in. If there's any physical health issues, we would ask the GPs to take a look, any nursing interventions that are needed. It would just be a case-by-case decision. Next slide. And that's it.
Okay. So I'm just going to stop sharing that, and then what we're going to do is we're going to share with you our local report that we've produced to just kind of showcase the work that is going on in NELFT. So what we've done is Rizwana obviously sees people in the clinic, and then produces all the data. And then what we've done is we've taken that data and put it into this report. Now, this report is just for Redbridge, Barking and Dagenham, Havering and Waltham Forest. So like I said, there is a pharmacist that will be starting for NELFT as well. So we're hoping to be able to do something similar within NELFT as well. So the report's just gotten a bit of an overview about Stomp, where it started, and then I won't obviously read this all out. We'll send this out so you can look at it in your own time. It then talks about the local service, so similar to what Rizwana's already covered, and the process as well of what happens. And then what we've done is we've put together a visual patient journey, which actually I would like to use to get patients and families to understand the pathway as well. So you can see here when they've met the criteria and they've been referred, then a medication review is carried out by a pharmacist. So in this case, it's Rizwana. And then the patient will be invited to clinic with their parent carer and asked to fill in a Lonza form, which collects data about side effects as a result of the medication. Then an assessment will be done and there'll be a reason behind the reduction, which will be explained. And then everyone involved in that process, so patient, parent, carer, has to agree to the reduction. And then if they agree, then a plan will be put in place. This will then be communicated to the GP, who will make the medication changes, and then the follow-ups will be carried out. And then again, at this stage, the Lonza form will be completed again so that we're able to assess the difference in the side effects once they're on reduction and afterwards. And hopefully, patients should see an improvement in their quality of life. So what we've done now is that we've put all the data together so far. So Rizwana, if you can just talk them through this bit.
Yeah. So everyone, please bear in mind that this was done during the middle of a pandemic. And then we had the vaccination program that started off, which took away a lot of my, my time and my work there. So we did start the work back in November, and with a bit of pausing and a bit of delays, we managed to identify 174 patients that met the criteria. So this was within all 4 boroughs. And I also forgot to mention at the start that I also work within Goodmayes Hospital and cover the learning disability inpatient ward there, which is called Moore Ward. So I like to include patients who meet the Stomp criteria within this report there too. So altogether 174, and then we started running clinics first in the Havering area, and then we moved on to Redbridge. I think it was back in March, and then Barking and Dagenham in April, and Waltham Forest will be starting officially next week. So out of all these patients, 40 have been placed on reduction plans so far. Sorry, Harpreet, can you just scroll down? And like it was said in the quiz, the majority of patients who are prescribed medication for challenging behavior, the medication prescribed is risperidone. And as you can see with the data, risperidone has been reduced in 49% of patients were prescribed risperidone, and that was the medication that was reduced. And then all the other medications includes this list here, but we have got a lot of olanzapine and diazepam too. So, you know, it's quite a mixture, but risperidone is there most commonly. And then just a bit about the LUNSA form. So for those of you that don't know, the LUNSA form stands for the Liverpool University Neuroleptic Side Effect Rating Scale. Now this is a tick box exercise. So I wanted to find a way before I started running the clinics on how I'm going to measure the outcomes and how I'm going to measure the data. So I had a look at different side effect tools that were out there, and this was one of my favorites because it was, I think it was quite easy to fill in, and it was something that parents and carers could do with the patient just by asking them questions. So as I said, this is a tick box exercise. It comes with 51 different side effects. Some of them are red herring, so some of them aren't a side effect of psychotropic medication. This will just identify if people are exaggerating or not. So you can see here, some of the examples are difficulty staying awake during the day, headaches, dry mouth, common side effects of psychotropic medication. The patients are told to fill it in if they experience it, not at all, very little, quite a lot, or very much. So out of the 40 patients that were seen in the clinic, we had a response rate of about 80%. So 80% filled it in before we saw them in clinic, while the reduction was taking place. And for those that completed the reduction completely, they filled it in again at the end. And then the data that I collected just shows that a lot of the common side effects that comes with the medication was greatly reduced once the medication was stopped. So parts of the body moving out of our own accord, obviously that's the EPSCs that come with psychotropic medication, that was reduced significantly. Difficulty going to sleep, restlessness, putting on weight was a big one. So a lot of people lost weight once the medication was reduced, constipation and difficulty in concentrating. So the data shows that the Stomp project has helped to reduce all these side effects and in turn improve the quality of life of our patients. So that's a really big achievement, and it's rewarding to see that their life has improved for the better once they're seen in clinic and once they're placed on reduction plans. So that's really nice to see. So this is just an example of one of the patients that was seen within the clinic. So Jimmy, age 46, male. He was diagnosed with a mild learning disability, and he lives in supported accommodation and needs minimal support for day-to-day activities. So although he lives in accommodation where carers are present, he is able to go out himself, do shopping, do exercise, etc., without someone having to go with him. So that would be patients with a mild learning disability. For those who have a moderate or severe, they might need a bit more care. They might need someone to go out with them to do the shopping, to do the day-to-day things. But in this particular case, Jimmy, he just needs minimal support. So in the past, Jimmy had issues of anger management and aggression with challenging behavior, and he was prescribed a risperidone by a consultant psychiatrist back in 2012. At the time that the risperidone was prescribed, he was not receiving any other support, such as positive behavior support, psychological support, or occupational therapy. So this means when we have within the learning disability team, we have the different MDTs. Each MDT has a caseload. So Jimmy was under the caseload of psychiatry, which would be the doctors and the consultants, meaning he wasn't under the caseload of the psychologist or the behavioral specialist or the OT, so he wouldn't be seen by them. Now we would like to refer the patient on, or if we feel like that kind of input is needed, we would share the caseload. However, back in 2012, this wasn't really normalized. So if they were under psychiatry, they were just under psychiatry, and the doctors would kind of make decisions about medication, and it wasn't really shared within the team. So that is something we are trying to change a lot within the teams, and get everyone on board and everyone to provide the input that's needed. So when the audit was carried out on the psychiatry caseload, Jimmy was identified as being eligible for Stomp. So I added him onto my caseload, and I did a medication review on him, and then he was seen in the Stomp clinic back in November 2020. So the initial consultation with Jimmy was by myself, the pharmacist, the consultant psychiatrist, and his allocated nurse. So Stomp was explained to him, and he was asked how he felt about having his medication reduced, and he was told that he would get support alongside through behavioural specialists and occupational therapy. Jimmy and the multidisciplinary team involved in his care all agreed to the plan, so we made sure Jimmy was in agreement. I provided Jimmy with all the information that he needed. I talked to him about Stomp. I sent him videos of YouTube links where other people in other trusts had gone through Stomp themselves and had success stories. And he was given all this information, and he was able to access it all and read it and then come to an informed decision. So once he was in agreement and everyone else within his care was in agreement, we agreed to reduce his risperidone gradually. So Jimmy was on 1 milligram twice a day, and over the course of 5 months, the risperidone was gradually reduced by 0.5 milligrams at 4-week intervals. And then as of June 2021, he had been off the medication for 3 months. So what impact do we think this had on Jimmy's life? So Jimmy was one of the patients who did fill in the Lancer form before, during, and after. And the data collected showed that he had a reduction in side effects that included a reduced sex drive, restlessness, weight gain, sleeping too much, lack of emotions, and difficulty in concentrating during the day. And this just shows how his quality of life was improved. So during the reduction plan, Jimmy did have some incidents where, he did show signs of aggression. He did show signs of aggression towards another resident, and we got a call from his accommodation to say they were really worried, and was it in relation to the medication being reduced. So at this point, we stepped in, we provided other interventions, we looked at his PBS plan. I asked the behavioural specialist to go in and do another assessment, and all other interventions were used, and the times where Jimmy did become aggressive, de-escalation methods were used, and the medication was not needed to be increased back. So this just proved that the other interventions were successful. So that was a good example of how Stomp has helped to improve someone's quality of life. And it's a good example to show how the patient was very much involved within the plan. Sometimes the patient will not have the capacity to consent, particularly those who have a more moderate or severe learning disability. So where they're not able to communicate or they're non-verbal. In this instance, we would take the view of the carers or the parents or whoever has the power of attorney of the patient to make those kind of decisions. But we would make sure they are involved every step of the way, just as the patient would be if they did have the capacity. So one thing we did once the project was well underway was ask for testimonials and feedback from a lot of the people that were involved. So you can have access to this report and you can read it in as much detail as you want, but I'm happy if you just stop there. One of my most favorite ones is done by a patient themselves. So as you can see, they put, when we had our first Stomp meeting, I was scared that everyone wanted to reduce my medication because how this may have affected me. Everyone was very supportive, telling me that I would be okay and explaining how we would reduce my medication by taking it step by step, reducing the amount I take until I stopped taking my medication completely. This helped me understand how stopping my medication would work. It was also explained to me why you wanted to stop my medication, and this helped me understand a lot better too. Since stopping my meds, I feel a lot better, more energetic, and have lost weight too. I exercise and I help keep the garden neat and tidy. I would like to thank everyone in helping me with stopping my medication. And when I read that, that just was so rewarding, and it was such a nice feeling. And that is actually word to word of what the patient actually said. So it's just really nice to, from their point of view, to experience how they thought Stomp was and how it benefited them. So I just think that's a really nice thing to see. And there was another one from a patient, a sister of a patient who is on the inpatient ward at the moment. So I won't read it as I did for the other one in full detail, but the sister just found that once the medication was reduced, she was able to have more conversations with her sister. Her sister was more engaging in activities. She had a lot of drooling before the medication was reduced, and she couldn't really talk properly because there was always a lot of saliva in her mouth. But since the medication was reduced, she was able to talk more. And it was just so nice for her sister to be able to see that. So that's one of my favorite ones too.
Yeah, but we've also put, you've put useful links. I've seen there's a question in the chat about this as well, but we've put the useful links in here as well. So there's like an easy read leaflet you can print off and give to patients. There's resources for professionals as well. There's a guide for people preparing to visit a doctor to talk about their medication. There's a really great video done by an organisation called Mix It as well, which talks about Stomp. And then there's a couple of videos here, which are about...
Yeah, those are the videos that were sent to Jimmy. So I think someone put in the chat they wanted to say those are the same videos that I sent through to Jimmy. So
yeah, so you can access those videos using on this as well. And then there's a whole Stomp section on the NHS website. So we've given the links for that. But we've also got them on the NELFT CCG webpage as well. So we've got a section for the Learning Disability and Autism Programme up on there now. So we'll share that link as well, and the report will be updated on there every 3 months. And then we'll put up updates about what we're going to do in NELFT as well, and just put general updates about what we're doing. So I think that's it for that. In terms of what we're doing next, we have plans to do more of these kind of webinars a bit wider. So we plan to take them to health and social care providers, care homes. We also want to do one for family and carers. So we'll be doing a bit of engagement work where we can reach family and carers to raise awareness. We'll be putting together a Stomp and PBS guide as well, which will kind of outline what Stomp is, what PBS is, all the other interventions as well, other than medication. It will talk about the risks of medication, and that will be able to be shared with families and carers as well. So that's the presentation. Do we want to move on to questions? So Rizwana, there's a question about GPs and how they can refer directly to the Stomp team.
Okay, so I'm working with the CCG pharmacists in the medicines management team. So I think there's a pharmacist dedicated within each borough who will carry out audits within the GP surgeries, and then during that audit it will be identified if those patients A, meet the Stomp criteria, yes or no, and then B, if they are on our caseload or not. So I think it was trialed in one GP surgery within each borough, and the particular pharmacist sent me the results of their audit. And to be honest, most of them were already on our caseload within the community learning disability team, and those that were not were just referred directly on through that way. So we will continue to do that. I appreciate that the vaccination program has taken quite a lot of people out, but I think once that calms down, I'll be back in touch with the medicines management team again, and we will get the audits running in all the GP surgeries, hopefully.
So the next question is about the video link. So we'll send the report out and you can access the video links in there. Do you cover Newham? So that will fall under ELFT, and we know they've recruited a pharmacist who'll be starting in August, and we've got a meeting with her to plan how this is going to be running in ELFT as well. So at the moment we can't really say too much because we haven't had that meeting, but once we know more we can, you know, start to update everyone about what the plans are for those boroughs as well. Is there any other questions? There's none in the chat. I don't know if anyone wants to come off mic and ask us anything. Thank you. And then, Rizwana, do you want to share the news about the Stomp as well?
Oh yeah, I forgot about that. So I nominated the Stomp project to participate in the HSJ Patient Safety Awards. So I had to spend a bit of time doing an entry write-up for that, which Harpreet very kindly helped me do. So a lot of credit does go to her too. And we found out last week that we were successful in being shortlisted for the awards. So the Stomp project has been shortlisted for the Patient Safety Awards 2021. And I will have to do a presentation towards the end of July to a panel of judges and to explain why we think the project should win. And if it does win, that will be announced in the award ceremony, which will be in Manchester in September. So fingers crossed. But it just shows what a big accomplishment the Stomp project can be. And, you know, we would have even better data and even an increased number of people on reduction plans had it not been for COVID or the vaccines. So it just shows, even in a short amount of time, the work that we were able to do was so significant and helped the small patients that we were able to see. So once we're able to dedicate all our time to it and focus on the Stomp project completely, we will have even more better results and an increased number of people placed on the plan. So hopefully their quality of life will be improved with that. So yeah.
Yeah, brilliant. I think that's it. Yeah, we're done. If no one's got any other questions.
Can I just come in on there?
Yeah.
Nasima?
Yeah.
Hi, so just a reminder actually that there are 2 further webinars coming up. If you haven't registered for them already, please do